Welcome back to the Dr. Somji Skin channel. I've got my trusted colleague here, Dr. Tino Solomon, or should I say Dr. Valentino Solomon, as
right.
he sometimes likes to be known. He's been working at Dr. Many Spa for a number of years dealing with skin. We see a lot of patients together, but today's topic is his speciality. It's pigmentation.
Indeed. So we've talked about treating pigmentation with acids, and we talk about the biochemical process of extracting pigmentation. You mentioned lasers now. Tell me about lasers and how they help, and what are the advantages and disadvantages, and why don't we use them in everyone?
So it's also, I think that everyone's different. So you look at the skin type again. So if you've got very pale skin type and you've got dark pigmentation, you can quickly remove pigmentation with a laser. So you don't need to go through this whole chemical peeling process, etc. And if it's just well circumscribed, i.e. like a little coin-shaped lesion, almost like cafe au lait spots that you can see on the face, then laser can be very precise into that area without damaging any of the other areas, and the downtime is also much less. So it's geographic, so if it's small discrete lesions, laser is very good. If you've got a paler background and the darker pigment, lasers work well because they all it's light, so it gets attracted to darker pigment, and it can be safer, so you don't need to do much prep either. They can come in and get a few laser sessions in that area, and they can hopefully get rid of it. Most of the technology based on removing pigmentation and laser is all based on tattoo removal wavelengths, because obviously tattoo removal is removing pigment.
So it actually performs both functions?
Performs both functions. So you can, the Q-switch Nd:YAG, which is like the highest strength one that you see, that works very aggressively and very well. And then you've got some which are like lighter light-based ones that just absorb more heat, and they just are a bit more gentler. So sometimes if I see if the pigmentation is a bit more red than it is brown, I might go for like a dye-based laser, so like a vascular lesion laser, and a different wavelength, because I think that it would absorb the heat much better.
So essentially what you're saying is that laser would be a quick, effective treatment for pigment in a limited area.
In a limited area and in skin types not like mine. So you're talking like 1 to 3. Anything more, please just forget about it, because you're just going to have problems.
And that is potentially one of the pitfalls or disadvantages, that it can, if used in the wrong skin type, and even if used in the right skin type, if it's too deep, it could trigger.
Sometimes you see some of the estheticians at the clinic, I tell them I said, we've got like so many machines, right?
Indeed, so even I get lost with them sometimes.
I've got more at home in my garage. But like, we've got so many machines, and I'm like, okay, patch test on that wavelength, patch test on that wavelength, patch test on that wavelength, patch test on that wavelength. See them in 4 weeks' time. Let's see which ones work better, and then we move on from there. So it sounds like it's trial and error, but it's just like when you've got so much kit like we have, that's so specialist for so many different indications, then you want to see what's best. And it's just happy to have a patch test. So never go straight up for a laser treatment. Always have a patch test to see how it works. But it can be a very quick and effective way of removing pigmentation. But I think moral of the story is once you've got rid of it, you need to maintain it. So it's like getting a six-pack and then just stopping working out. You can't do that. That's it from us. If you have any questions about pigmentation, just pop it in the comments below. Don't forget to click that bell button, which basically alerts you when new kind of exclusive videos come in. If you want us to talk about anything special, just let us know. But that's it from us today. Thank you so much, Dr. Solomon,
Thank you, Dr. Somji.
Speak to me.
Pleasure.
More to come, right?
More to come indeed.
Yeah.